Welcome back here today on the beautiful campuses of Florida Panhandle Technical College. We just spoke to Donna Carnley from Early Learning Coalition talking about their cooperative partnership with Florida Panhandle Technical College. Here right now with Shayan James, one of the students in the Patient Care Technology program here on the campus. Shayan, we wanted to sort of get a perspective from one of the students. You guys this morning were at the Imagination Station here in downtown Chipley doing screenings on basically pediatric patients in the real world, children under the age of 5 in that child care provider environment. First, let's start at the beginning. You guys are almost done with this patient care technology program, is that correct?
Yes, we'll take our state test in December.
Wow.
The 15th through the 18th.
Okay. When did you actually start the program?
We started in August, the second week of August. I think it was the 12th.
Okay, and so how long is that total program?
It's a 6-month course. It's usually about 600 hours.
Okay, and did you come here right out of high school or did you do something else?
No, I took a year off after I graduated. I graduated in May of 2014.
Okay.
And then I started here in August.
And what is your home? Where do you live?
I live here in Chipley.
Had you known about the technical center, as it used to be called, Washington Homes Technical Center, for many years, what people called the VOTEC, just within the last year and a half, it's been a technical college.
Yes.
Had you been aware of what that technical college offered all those years that you lived here?
Yeah, I have brothers and sisters that have been here before, so I kind of was used to it. Mm-hmm.
What amazes us is that for a community as relatively small and rural as we are, to have the availability of this kind of a facility is pretty amazing. Almost all of the classes who graduate here have a 100% chance of getting a job, whether it's the culinary program, the cosmetology, welding, practical nursing. It's very interesting that many times kids out of high school want to go to a 4-year college. I get it, people want to go to college, but when they get out of that 4-year program, they're $150,000 in debt. They have to move home with mom and dad because they can't find a job because most of the time they've got a degree that's really not going to do much good for them. In your case, in a 6-month period of time, and you could have come into this right out of high school, you chose not to, you've got pretty much a 100% chance of getting a job. Have you already started exploring the job market?
I kind of want to work in a hospital. That's where I think I want to go, but no, I haven't put in applications or anything like that.
Have you talked to people, though, yet and finding out that there are indeed opportunities within those hospitals? Nursing homes, I would imagine,
Yes.
Doctor's offices? So you were actually under the tutelage of Melissa Watford initially for patient care technology?
Yes.
And she recently left. Ms. Rhonda is now your teacher?
Yes.
And she'll finish up with you for the rest of that course?
Yes.
What phase of nursing do you find most interesting?
The hospital.
Working in that hospital environment?
Working in the hospital environment.
What's the most challenging part so far within your training?
Probably the nursing home. It was hectic.
Having to deal with people at that advanced age?
Yeah. Well, no, it was more that there was so many that we had to help. It wasn't just
workload.
Yes, the CNAs there, they do 8 to 10 people for their hall, and we only had like 2 or 3, but that was still, we had to help them with anything they needed. So.
Yeah, not real glamorous work either.
No, but it's good work.
I would say that no nurse gets into it for the glamour because no matter what kind of a nursing facility or environment you find yourself, none of it's glamorous.
Yes.
You're dealing with pretty much all the basics of everyday life that nobody wants to deal with. Hats off to you for wanting to be in that environment, in that profession. It's a calling. It truly is. It's not just somebody looking for a paycheck. Not only is the training tough, but again, it's not glamorous and it's work. So rewarding, though, I would imagine.
Oh, the people are great.
Do you find that already in your clinical environments? What we're here today to talk about is the screenings that you guys have been doing as part of that cooperative program with Early Learning Coalition. Today we're at Imagination Station. Have you done those kind of screenings before with that age group?
Well, we did it the week before we went for Thanksgiving break. We went all over the place. So yes, we've been to a few daycares before Imagination Station.
Do you get to spend a lot of time with kids in that age group in regular life?
Not really, no.
So it's sort of a challenge, I would imagine. Would it be fair to say that that's a really good learning opportunity?
Oh, it's a great experience.
We were watching you, and we're showing some of that footage right now. Keeping a child's attention, because when they come into that room with all that equipment, they're just everywhere. But for the most part, the kids were well behaved. They seemed to be in awe of what you were doing. And again, you guys had one kid right after the other.
Yes.
If you were in a hospital environment, pretty much the same, I would imagine. What was the most fun part of doing that in that daycare setting today specifically?
When we do the hearing test, the kids are always so excited to hear the train, as we call it. It's great. They're always smiling and laughing about it.
We just got done talking to Donna Carnley from Early Learning Coalition, who is sort of your liaison when you're doing that. One of the things we talked to her about was the fact that in many cases these children wouldn't be necessarily getting this regular medical attention necessarily. So in this environment, they're actually able to get kind of a freebie medical attention while they're in that child care provider. Have you, in the screenings that you've done so far, come across anybody who had deficiencies and maybe would need to have further medical attention with a possible problem?
We do have some vision refers and hearing refers, not many. Most of them are really healthy, but we do have some.
So that's got to feel good right there, because I needed glasses probably from the time I was very young. It wasn't until I was in the 4th or 5th grade that my teacher sent me home and said, tell your parents to get you glasses because you can't see what's on the board. We were unaware of that. So if there had been screenings, and this was a long time ago obviously, if we had had those regular screenings like you're providing, we may have found that problem earlier, and I'd maybe be a smart guy now instead of doing what I'm doing for a living. Thanks for taking the time. I know you were a little reluctant to come on. You did great. You're well-spoken. Maybe you would like to come on after you graduate, after all the pressure is off, and talk a little bit about that holistic experience, all of the training, and especially if by that time you're in that workforce and you have a job. Would you be willing to maybe do that somewhere down the road? Best of luck going forward. Our agency takes the pictures at graduation, so we'll be seeing you again maybe when that happens. I think when we spoke about graduation, you said probably by the time you graduate, you're going to be off working and probably not take part in that. But we also come around the classroom, so I'm sure that at some point we'll see you along the way. Cheyenne, thanks so much for taking the time. You were brave to do it. Hopefully we'll get another one of your fellow classmates to come on up here. And again, best of luck going forward.
Thank you.
Here right now with Cheyenne from the Patient Care Technology Program here at Florida Panhandle Technical College. It takes a lot to get up here, get a microphone strapped on you, and get before the cameras. Cheyenne, I think you'll agree, did a great job. Over 40 degree and certification programs currently offered right here on the campus of Florida Panhandle Technical College. An opportunity for you to retool your life if you find yourself in a situation where you've been downsized, a good way of saying you've lost your job. If you're an adult and you're looking for another career path, if you're not quite happy in what you're doing, if you're a high schooler and are interested in doing some dual enrollment, absolutely no cost for that. We have in many cases high schoolers graduating from college at the same time they're graduating from high school. Just some real good opportunities here. If you want to find out more, you can come by the student campus offices here on Hoyt Street in downtown Chipley. You can go to our website, fptc.edu, or you can simply give a call. Those numbers and website on the bottom of the screen right now. Thanks for watching. Every time I do a show here on the Technical College campus, I learn something. Hopefully you do too. We'll be right back.